Antibiotics are one of the most frequently tested topics on the NCLEX. And it makes sense. As nurses, we're constantly administering these medications, monitoring their effects, and educating patients about their safe use. The exam does not expect you to memorize every single drug on the market. Instead, it focuses on your ability to apply critical knowledge to patient care. So, in this section, let's walk through the essential points you must know about antibiotics. We will cover major categories, common side effects, key nursing considerations, and typical NCLEX style questions that will test your judgment. First of all, let's start with the basics. Antibiotics are drugs designed to fight bacterial infections. That means they will not help in viral conditions like the common cold or influenza. This is a classic NCLEX trap. If you see a patient with a viral infection being prescribed antibiotics, you should immediately recognize that this is inappropriate use. Another principle is the importance of completing the full course of antibiotics. Even if the patient feels better after 2 or 3 days, stopping the medication too early may cause resistance. So, if you see a question where the patient says, I stopped my medication because I felt fine, the current nursing intervention is to reinforce adherence until the prescription is finished. Now, let's explore the most common antibiotic classes that appear on the NCLEX. Penicillins and cephalosporins, aminoglycosides, tetracyclines, macrolides, fluoroquinolones, and sulfonamides. Penicillins and cephalosporins. These are beta-lactam antibiotics. They are often tested because of the risks of the allergic reactions. If a patient is allergic to penicillin, they may also react to cephalosporins. The NCLEX may ask, which patient should the nurse see first? If you see a patient developing shortness of breath or a rash after penicillin, that is your priority. Aminoglycosides, for example, gentamicin. These are powerful antibiotics used for severe infections. The main side effects are ototoxicity and nephrotoxicity. A classic NCLEX clue. If the patient reports ringing in the ears, dizziness, or a sudden decrease in urine output, the nurse must notify the provider immediately. Now, let's talk about tetracyclines like the doxycycline. These antibiotics are contraindicated in children under 8 and in pregnant women because they cause tooth discoloration and impair bone growth. Another NCLEX favorite is the interaction with dietary products. Patients should avoid milk, antacids, and iron supplements because they reduce absorption. Macrolides, such as erythromycin or azithromycin. These drugs are often given when patients are allergic to penicillin. The NCLEX likes to highlight cardiac complications, especially QT prolongation. So, if a patient is taking another drug that affects the heart rhythm, the nurse must monitor closely. Fluoroquinolones like ciprofloxacin. Here, the main risk is tendon rupture, particularly in older adults or patients on steroids. If you see a question about patient reporting sudden axial tendon pain, the right answer is to stop the drug and notify the provider. Sulfonamides such as trimethoprim sulfa. These drugs often cause hypersensitivity reactions and photosensitivity. Patients should be instructed to drink plenty of fluids to prevent kidney stones and to protect their skin from the sun exposure. Across all antibiotics, there are general nursing points that NCLEX repeatedly test. Always check for allergies before administration. Monitor for signs of superinfection, such as oral thrush or diarrhea, which may suggest Clostridium difficile. Teach patients about photosensitivity risks with certain drugs like tetracyclines and sulfonamides. And remind patients to take antibiotics exactly as prescribed, at evenly spaced intervals, and never to save the leftover doses for future use. Now, let's practice with some examples. A patient receiving gentamicin reports tinnitus and vertigo. What should the nurse do? Stop the medication and notify the provider. A child under 8 years old has been prescribed doxycycline. What is the nurse's best action? Contact the provider since tetracyclines are contraindicated. A patient taking ciprofloxacin reports severe cough pain. What is the priority intervention? Hold the dose and notify the provider since they suggest tendon rupture. These scenarios demonstrate how the NCLEX expects you to connect knowledge of side effects with safe nursing actions. To wrap up, here are 5 strategies to keep in mind when antibiotics show up in the exam. First, always assess for life-threatening reactions first, anaphylaxis, respiratory distress, or severe rashes. Second, think about organ toxicity, ears and kidneys for aminoglycosides, liver for macrolides, and tendons for fluoroquinolones. Third, remember the spatial populations, no tetracyclines in kids or pregnant women. Fourth, reinforce patient teaching. Complete the course, avoid alcohol with metronidazole, and avoid meal with tetracyclines. And fifth, and above all, always choose the action that promotes patient safety and prevents complications. Antibiotics are a cornerstone of NCLEX pharmacology questions. They test your ability to prioritize, recognize red flags, and educate patients effectively. By focusing on these high-yield principles, you'll approach antibiotic questions with clarity and confidence. If you found these lessons useful, I encourage you to use this material as part of your daily study routine. And remember, consistency is key. Finally, don't forget to follow us on social media for more strategies, case simulations, and study tips. You can find us on Facebook, Instagram, TikTok, and YouTube as Enfermeras en USA and NCLEX con Enfermeras en USA. Let's keep learning together and move one step closer to your goal of passing the NCLEX and practicing nursing in the United States.